Greetings, everyone. Today, I want to welcome Dr. Michael Berglund to the Mom Chief of Everything podcast. Dr. Berglund is a doctor of chiropractic, a board-certified chiropractic internist, and is currently an officer on the Council on Internal Diagnosis and Disorders. He is also the author of Tired of Being Sick and Tired, and owner of Berglund Health and Wellness Center. Dr. Berglund, can you go ahead and get us started today by sharing a bit about yourself and why you are so passionate about what you do?
Thank you so much, Jeanette. I always tell people, like, when people talk about work, they have to go to work, and I always tell people I get to go to work because one of my passions is helping people, and I love doing what I do because there's not enough people doing what I do, right? Which is basically help people actually restore them to normal health. There's a lot of people out there that are trying to help people with some symptoms and help people manage stuff and help people through the day, fall asleep at night, stop the heartburn, stop the rash, all this other stuff. But when we talk about getting to the root cause of the problem and figuring out why do I have this in the first place, that's the thing that I get to do every day, and people just and not to, because I make a big deal. I get to change lives. I get to help people like take control of something that they thought there's no way that I'll ever have control of this, and I go, yeah, well, the thing is I have to, and I end up blaming people for why they're in the situation they're in. They have an eczema rash on their arm. I'm like, well, it's your fault, and they go, well, I didn't know. I'm like, right, I'm not blaming you. I'm just saying, now you can fix it. This is your problem. Now you can turn around and fix the problem because you did it, so you can undo it. Whereas a lot of times we're told, nothing you did, nothing you could do. You just have to rely on my medication. You just have to rely on my expertise to manage you where you're at, and then you won't get worse, or then it'll be under control. But as soon as you leave me, then everything's going to fall apart again. And I don't know. I hate that mentality. I hate that idea that like you're leaving people vulnerable and dependent. And I'm like, I just want to empower people and make them feel like I can do this.
Great. Yeah, we have a similar philosophy in that, like empowering people so they don't need us all the time. They just need to come back and check in if there's a flare up or something new is happening. Now, can you explain a little bit about the difference between a doctor of chiropractic and a doctor of or a board-certified chiropractic internist? How does holding both credentials, kind of be a difference maker on what you do and how you practice?
That's a great question. Yeah, the specialty chiropractic internist isn't really a common one, and it is just exactly what it sounds like. It's a chiropractor that's also an internist. So typical chiropractors, we're trained to deal a lot with neuromusculoskeletal problems. So, if you have tingling, if you have pain, if you have headaches, back pain, neck pain, even extremity pain, wrist stuff, carpal tunnel. We're really good at, the chiropractors are really good at that stuff. And we're trained, the funny thing is we're trained to do all of it. We're trained actually as primary care practitioners, but when we get into the internships and the residency programs, we're really limited to mostly musculoskeletal patients. So what everybody feels comfortable when they leave chiropractic college is they feel comfortable doing neuromusculoskeletal stuff. They don't necessarily feel exceptionally comfortable treating a diabetic. So as a chiropractic internist, I've taken an extra specialty and gone, 3-4 years in training to learn how to help someone with thyroid problems, help a diabetic, help someone with a rash. Generally, the idea is anyone that comes to my office that would come to a primary care, a general internist, a general practitioner, and is going to get medication or some prescription from that, could come to me, and they could get fixed through the same thing. It's obviously a different treatment plan, but the chief complaint, the presentation is going to look the same. So as a chiropractic internist, we're trained. Now, we're actually trained to do a lot of things that would surprise a lot of people. We go through pelvic exams, breast exams, prostate exams, genitalia. from like male genitalia, that kind of stuff. We do. We're taught how to treat cancer. You know, it's a whole political thing when you start talking about doing that, but we're taught that. We're taught endocrinology, allergies, dermatology, you know, neonatology. You know, I have someone that I know that is an easy step for her to go in and has some slightly additional training, and then she's a midwife. So we're set up to know a lot of different things in lab work. The thing about the chiropractic internist versus someone who has maybe especially in nutrition is the chiropractic internist is one of those that relies heavily on diagnosis. Okay, so we train up a lot of like EKG, spirometry, lab testing. We use a lot of the alternative lab testing. You know, a lot of people will sit there and, you know, if they have menstrual problems and they're wondering, you know, where my hormones are at, a medical doctor may go, I'm going to do this blood testing and it's serum testing for this. A chiropractic internist is going to go, well, yeah, the serum testing's fine, but it's a snapshot of what's going on at this moment. We're going to send someone out for a full month-long saliva testing, which the saliva is more reflective of free progesterone and free estrogen levels. And then we'll measure it on day 1, day 6, day 12, day 15, and we'll have a little graph, you know, that will show where's my progesterone, where did I ovulate, where did I do this, and we'll look at, you know, all the different hormones during that time frame. So again, that's what we're trained to do, so that, you know, a lot of people think, well, this is kind of hokey. This is, you know, you guys are, no, we believe in objective measurements. We believe in the training that we have, and as a med tech, I was a med tech before I was a chiropractor, so it was really, really easy for me to jump into the lab testing because it's what I was doing before I even became a doctor. So
I understand. So that's fascinating because I definitely don't think a lot of people realize the whole scope of your practice and what you can do. Because I know when I first met you, I wasn't aware of all the different things that you were capable of doing. And one of the things that I appreciate is the non-medication route, letting the body heal itself, but setting the body up to win instead of to fail. And I think it's such a huge component of achieving good health. And a lot of people don't want, you know, in today's age where there's so many side effects to medication, or people don't know what the long-term side effects and use of medication are, they're becoming a lot more skeptical. And knowing that there's a resource like yourself that they can go and get checked and not be just prescribed medicine as the first choice. But, you know, I'm not saying that people don't need medication. I'm not saying that.
No, some do.
But to know that there's alternatives and somebody can exhaust all conservative measures first before going that route is, I think, a very hopeful opportunity for people. So you kind of mentioned a lot of patients that you might see. It sounds like you see people with the thyroid disorders, diabetes, hormone disorders. Is this the type of commonality of a patient that you might see, or are there other, is it more of a general population? You know, do you have a specialty that you tend to focus on?
I would say, you know, I'm pretty good at a lot of different things that would present to me. Now, there's sometimes where, you know, I'm like, we get into, you know, people that have more advanced conditions. You know, certainly I don't feel comfortable treating cancer. So I made a choice that someone has cancer. I don't want to be the point person. I don't mind just helping them out with some basic nutrition, telling them, okay, boost this, lower this, but figure out what direction they should be going in and evaluate their cancer and everything. I'm just not comfortable with that. I'm also not doing, you know, pelvic exams in my office, even though I'm trained to do them. I don't do obstetrics. I don't do gynecology. So those are limits that I've made. Obviously, and I'm not doing surgery and all the other, you know, I don't do surgery. I don't do stitches, you know, for obvious reasons. I'm a chiropractor by license in the state of Wisconsin. However, the things that I see a lot of is I see a lot of adrenal problems, thyroid problems, endocrine issues. I see a lot of people with with skin issues. I had a new patient come in the other day with just acne that's popped up. It's a strange case, where, she started doing the keto diet and her period self-regulated, and then she stopped doing the keto diet and her periods went funky, and then she started getting acne. And then it's just like this whole back and forth thing she tried out, and then finally she went back on keto, but the acne didn't go away. I'm like, oh, well, let's try and figure this out, because there's probably more than one thing going on here. So then we have to walk through all the possible causes that we might be uncovering here, and see where she is with that. So but thyroid's been my thing for a while. That's what I really, I think people come to me that have really struggled in that area, and I give them some clarity, mainly because the thyroid lab tests that we've come to rely on are not that effective, are not that clear, are not that true to diagnose people. So some people come in and all their thyroid tests look perfect, everything's right in the range, and I'm like, yeah, you're hyper or you're hypo. And they go, how do you know? I said, your symptoms, how your body tests. And I said, and they go, well, like, could you be wrong? I go, here's the thing. I can always be wrong. We as clinicians have to treat the human body with a lot of humility, don't we? Right?
Yes.
That every body that comes to us, doesn't always read the textbook and how they're supposed to respond. So everyone's unique. And so, like, you have to be humble about it. So could I be wrong? Absolutely. But here's how we'll know. I'm saying this symptom, this symptom, this symptom, this symptom, I think are related to the fact that you're hypothyroid. So let's treat this, right? Let's give you some support to help your body make more thyroid hormone and get your body functioning better. And let's see which one of these things gets better, improve, the symptoms get less or go away. And then we'll go. So then that, to me, that proves that I was right. And again, The key is not being right. The key is like figuring out like what all these things are about. And if it's this, then these should resolve when I treat this. Right.
It's treating the symptoms. And I agree with you about the textbook. Like, I think as specialists and as I've practiced longer, and I'm sure you can attest to this as well, the people that I typically see as a specialist, I'm seeing the 20% of the people who aren't following the textbook. So I would say that 80% of the time, a specific injury kind of follows a similar pattern with the healing process. That's how the tissues heal. But 20% of the people don't follow that, or they get stuck in part of that healing process. And then they need someone like us to help them get unstuck from that phase that they're in. And I think that's who we tend to see, because I always kind of joke around and say, people don't actually come to us for pain. They come to us when the pain is so bad that it's interfering with what they want to do.
Right.
Or in your case, if you're treating somebody with the thyroid or the hormones, when it's creating such havoc in their life, that's when they do something about it. But most people have this little bit of a level that they can tolerate. And then when it reaches the level they can't, that's when they seek assistance.
I've had more than one patient that's presented to me, but I have a patient of mine that just, that I saw recently, and she had really bad anxiety, which you would call debilitating anxiety. And that level of anxiety was making life almost impossible. And so, she was seeing an acupuncturist. They managed it for a while, and then all of a sudden it was unmanageable. So then so the acupuncturist referred her to me, and then the next stage is, well, like, what's going on here? And I'm like, I think your thyroid's running crazy high. So let's control food. Let's because I think there's some food allergies. I think the high thyroid is affecting your adrenals, which then and the low adrenals are what's causing all the anxiety. So I don't need to give chamomile or skull cap or any of these valerian, passiflora, L-theanine to help with the anxiety, because then I'm just giving them something to manage them, right? So if I can figure out there's a root cause for the anxiety, if they're running, if their body is hyperthyroid, right? Then it's going to feel like I'm on 3 pots of coffee, every day for like the last 6 months. And you can imagine going, oh my gosh, that would feel horrible.
Right.
And you think, why aren't they just all racy, and why are they tired? And like, because they're not getting good sleep, because they're not this. And so then you keep walking down that path and you go, this is where they are now, right? So now I do have to fill the adrenals up, but I can't fill the adrenals up if I don't deal with the elevated thyroid. So we deal with the elevated thyroid, and just the other day she was like, oh my gosh, like I can feel the anxiety. I know it's in there, but it's such a small level that I can function. And I'm like, that makes me happy.
Right. And I like what you said about food, because I think people are really starting to realize the influence of a good, well-balanced diet and nutrition. I mean, you can't really say it enough, and people don't always want to hear that. You got to get your 5 to 9 fruits and vegetables a day, eat your whole grains, drink enough water. But really, I joke around and say if the food wasn't around before the 1900s, it probably isn't good for you.
Yeah.
So in your book, Tired of Being Sick and Tired, you share some insight about more of that holistic approach that you've already been talking about with the thyroid problems, and the focus on stress hormones, estrogen, drinking water, diet, as well as many other factors. And can you share a bit, we're in the middle of a pandemic right now with the coronavirus or COVID-19, and how much is food? I mean, this is one of your expert areas. How much is food a player with the immune system? You've already addressed the thyroid and some of the adrenals. How much is food and diet and what people are taking in and putting in their bodies influencing their immune system and their susceptibility to whether it's the coronavirus or the flu or the common cold?
Mm-hmm. Yeah, the trick with food is different people, food does different things too, right? So in some people, it's a gastrointestinal irritant. In some people, it's an inflammatory agent. In some people, it's a trigger for autoimmune disease. In some people, it triggers migraines, right? So the goal is for me, is to start connecting dots, right? Is to help the patient going, when I eat this food, right, it does this to me, right? So then if I don't want this, then I have to stop eating this food. It's one of those dumb moments. But again, the problem is people don't know where to start. And if you go on the internet and ask, what should I be eating, right? You'll get, everything you'll get polar opposite responses. There's everything to, you should be a vegetarian, to you should eat ketogenic, you should eat paleo, you should eat Whole30, you should just eat rice and beans, and just a plethora of responses out there. And you go, well, why are so many people confused when this is the way to go? And I'm like, the problem is there isn't a perfect diet for everyone, right? Otherwise I think this would be really, really easy. The challenge is there's people that are prone to having problems with carbohydrates, and we need to move them over to more of a ketogenic diet and more, and some people say, well, that, a high animal product diet. I'm like, all I know is that these people, their blood work improves, everything improves when they eat this way, right? And other people, they need to be vegetarian. They, the animal products, the fats, the cholesterol just mess with them, right? And so for those people, they need to be over here, right? And then there's other people that are massively grain sensitive, and then there's a whole gray zone of that, right? There's people that are, there's people that I diagnose that are just new wheats, Americanized wheats. If you give them old, ancient European wheats, they're fine with those. They just have a problem with it. Then other people, it's all wheat. Some people, it's all gluten, right? And some people, it's
Mm-hmm.
gluten and corn, and it's gluten corn. Some people, it's even gluten, corn, and rice. And people are like, rice, that's supposed to be hyperallergenic. I'm like, and it's everybody's different, right? And so the key is, if a patient comes in to me, they don't need to read a book that tells them the whole history of food, right?
Right.
And why this food and this food and this, they just need to know for them, right? There is no perfect
Mm-hmm.
diet, so we can kind of check that off the list and say, don't worry about trying to eat a perfect diet because there is no perfect diet. Okay. So now let's try and figure you out, right? Let's help you figure you out. And then we start talking about going, well, how does this relate to what we're all dealing with now with the infection and everything? It's like, as we eat well, right? It's a plus to our system, right? It
Mm-hmm.
is food that comes in and nourishes, right? Now there's food that just is kind of, I would call neutral food, right? You just go, it provides the basic, what it's supposed to. Like if I gave someone, if I fed myself white rice, I'm not diabetic, so it's not going to do me harm, right? But how
Mm-hmm.
many nutrients are in white rice? Not a lot, right?
Right.
Not a lot of B vitamins, not a lot of minerals, not a lot, just not a lot of electrolytes, certainly hardly any protein, but it's carbohydrate. My body burns carbohydrate. So it's something. It's kind of like it fills checks one box, but it's not complete, right? And
Right.
so for me, we need to show people like what complete looks like for them, like what helps them, and then certainly want to avoid the bad stuff. If this is negative food, right? If it's doing negative things to the body, like it doesn't matter if we're it's like, well, there's protein in here, or there's fiber in here, right? Well, if this is harming them, okay, so right, so we're helping you and hurting you at the same time, right?
Mm-hmm.
And if this is immunological, right? If the body's having an allergy reaction to it, this is distracting, right? So when the body's sitting there trying to focus on a virus or trying to focus on this, if it's sitting there dealing with this is distracting to the body, and it can't focus on what it needs to focus on, which is, real pathogens, real infections, right?
Right.
And and when the adrenals are low, that's a safety net for the immune system, right? There's a spleen, the spleen functions in that. So if the spleen's functioning low, that's a necessary component. The thymus is functioning low, that's a necessary component. There's a bunch of things that for the immune system, people tend to go, well, I did my vitamin C and zinc, or I take astragalus, or something, and I go, and again, they say everybody should be doing this. So I'm like, it's like saying, well, I was thinking the other day, it's kind of like, like I have a problem, going on plane rides, right? Because those long trips bother me. And someone goes, you know what you need? Before they even ask what the problem is, right? You know what you need? One of those neck cushions, right?
Mm-hmm.
And they'll help you sleep. They'll help you this. They'll help you this. And the other person's going, I have irritable bowel. That's why I have a problem on planes. I need to be in the bathroom. I need to know where the bathroom is, or I have problems with swollen feet, or I have problems with clotting, or I have problems, or I'm claustrophobic, right? This is not
Right.
going to help, right?
Right.
So people need to
Exactly.
know what my problem is, right? But they also need to, as doctors, we need to help them figure out why, why are you getting sick all the time? Oh, that's a good question. Why are you getting sick
Mm-hmm.
all the time? And if we don't know, or if we can't see them, we're doing telehealth, like we talked about earlier, before the call here. It's like, which is kind of a big thing now. We need to then give them a really broad spectrum support. So if we're dealing
Mm-hmm.
with endocrine system and estrogens, we need to figure out, we need to give them a broad support for, that could fix all estrogen, right? That, if there's hyperestrogen, if there's this and this, or we need to get progesterone, but then we need to figure, okay, it also could be this. So we either need to do trial or error. We just need to, again, it is not like an easy, there's not an easy solution in the natural realm, because
Right.
when we deal with the medicine, we go, oh yeah, like Benadryl. You have an allergy reaction, Benadryl, right? And
Mm-hmm.
most people, it dries up and hives go away and blah blah blah, right? Because it's not fixing the medicine. Can just, you take Vicodin, it solves. You can take, prednisone, it solves a lot of problems, right? But it
Right.
doesn't solve the core root of a lot of problems. It just makes things just go away, right?
Right.
Only to come back later on. So it's a
Right.
it's a tricky thing.
Right. And that's so true. Like I think of in my own personal life when I used to run marathons, what would they constantly tell you before a long run or a race? Make sure you carbo load, get the pasta, get the, meatballs if you do meat and stuff. I would feel awful doing that, but what I discovered is I felt great if I had rice and chicken. That's how I carbo loaded the night before, was rice and chicken, because the meatballs and the pasta just sat there.
Heavy,
you know,
too heavy,
and it
right?
was too heavy. And in anyways, when you're in a marathon, you're tapering for 2 weeks before, 2 to 3 weeks before, so you're not eating or you're not running as much, but you're still eating the same. So you're already carbo loading technically.
You've already done it. Yep.
And then to load up even more on a heavy meal the night before, it never worked for me. And I discovered that, and I was like, no pasta dinner, please. So that's a kind of a very relatable, I think, story for people. That's where the masses are saying spaghetti and meatballs the night before, but my body rejected that. I want chicken and rice.
And you figured it out by trial and error,
I
right?
did. Unfortunately, too many trials.
Yeah, unfortunately, because we're all unique, you almost have to, you just have to admit that you're going, I'm going to experiment. And
Right.
and the person is telling me something to do. Let me try their elderberry syrup. Let me
Right.
try they're telling me that Astragalus worked for them all the time. I'm like, I'm sick. Let me try Astragalus. Let me try throat coat tea. Let me try, you just experiment as you go through and you figure out that doesn't work for me. In fact, that makes me sick, or that does this to me. And you just start learning as you go.
Right,
So,
right. Now you've been practicing since 1991, and when people come in and they're kind of all up in arms like that, and maybe they've done some trial and error on their own, is there anything that when you're working with somebody, are you doing trial and error, or are there tests that you can do and use some of those diagnostics that you mentioned to narrow it so you can kind of focus them a little bit more?
yeah, my take has always been, I always joke that my clinic is kind of at the corner, right as you get to Witt's End. I have like a little shingle that sits out right by Witt's End, because people I'm the last person they see. I don't know if they it's I'm not covered by their insurance, or I'm or they know I'm going to ask a lot of them to do a lot of homework. I don't know, but I'm always the last person. I've been to Mayo, I've been here, I've been there, I've been as a specialist. Go ahead, Dr. Berglund, let's see what you can do. But
Mm-hmm.
I do most times, because I'm the last person, they've had lab work done, and I love seeing the lab work, because sometimes the lab work hasn't been read properly, and so I go, oh, there's a problem here, and they go, they said it was fine, or it's not, it doesn't say H or L high or low on the thing, and I'm like, yeah, but it's not really okay. And but a lot of times, then if everything looks fine on the lab, they say I'm fine, but I'm, of course, I'm not fine. So then I use some muscle testing as part of my parameters. So I use that
Mm-hmm.
as another diagnostic tool. And all these things are just, I feel, are diagnostic tools in my tool belt, right? So the chiropractic, yeah, I'm a chiropractic internist, but I'm still a chiropractor. I love chiropractic. I love, doing the physiotherapeutics, ultrasound, interferential. I love doing foot orthotics for, for people that have, flat feet or issues with their arches and that kind of stuff. There's a bunch of tools in my tool belt that I love.
Mm-hmm.
So blood testing is one, but my diagnostic muscle testing is another one, which is kind of a weird thing, but most people understand when I explain. I'm like, if I did the exact same things everybody else has been doing for you, if I use the same tools to diagnose you, I would come up with the same answers they all came up with, and same treatments, and that seems really dumb to offer the same treatment that everybody else has offered. So I do the weird things, because most people don't want to most doctors don't want to do the weird things. So but then I'm able to help people that a lot of people could never help. So
Mm-hmm.
which to me is like the ultimate, for someone who's a natural helper, is the ultimate thing, to be able to have a unique gift to help people that are really feel like they're at wit's end, right? And that there's
Right.
actually a treatment for them, and they're not going to just have to suffer for the rest of their life with whatever they have.
Well, Dr. Berglund, this has been a fascinating conversation, and I really appreciate you coming on today. So cool to learn about the chiropractic internist side of things, how you really treat holistically and combine the kind of the therapeutic approach that a chiropractor utilizes, and then the chiropractic internist approach, which is looking at the whole body, the nutrition, the food, the thyroid, the adrenals, a number of other uh, um, things that you mentioned. And I'll let people go back and listen a couple of times to this and realize, oh, wow, maybe I should call him and let him be the first person instead of the last person.
Yeah.
And just, I really like to the diagnostic side of things. I'm kind of a numbers person, and some people in the audience may be a numbers person, and they want to see like what's high, what's low, where should I fall into? And they kind of need that proof. And, you know, I'm in the science field, so I think that's a good fit to have those numbers, and then also the symptoms, and taking the diagnostic side of the treatment approach, and then taking what is the person actually telling me? What are they feeling? How are they interacting with others? And how is food interacting with them? Taking all components of their well-being and putting it all together from a science and a holistic approach. I really can appreciate that philosophy of care. Is there anything else that you would like to share with the listeners today?
I guess I would like them to know in these times that just don't live in fear, right? Because fear is going to get you nothing at this point. Just do the things you know how to do. Find people that can help you through them. Don't isolate yourself too much. Make sure that you have contact with people. We need, as human beings, we need contact. That's how our God made us, to be, in unity with other people and fellowship with other people. Mm-hmm. So make sure that you do all that. Do the washing hands, do all the stuff you need to protect people around you, but also make sure that you're just staying positive, not living in fear, and know that things are going to work out.
Yeah, great. Thank you so much. And to all my listeners out there, thank you for joining in and listening to us today. Until next time, be bold, be beautiful, and be you.